I'm Ryan, and I will be talking about joint modeling in heart failure. So what is joint modeling? Well, that's a good question. It's exactly what it sounds like. No, it's not a technique for modeling elbows and knees. It's a technique for combining models. So we take two or more models and join them. For example, we take data from a clinical trial. We have data from patients' blood results and data on whether the patient or not died or not. We can then combine this data using a joint model. So why would we do that? Well, that is a good question. Combining data improves efficiency. There's less waste of data, and it can make predictions more accurate. Joining data can also be hard, so joint models help. For instance, the data we have isn't easily compatible with each other. The data from patients' blood results is measured multiple times, and it's also subject to biological variance. For example, when you go to doctors, they'll take your blood pressure, but they'll often take it 2 or more times, as it's not likely to be the same each time. Also, patients can not only die, but just leave the study. This can cause issues as these patients cannot have their blood taken and results in missing measurements. And patients don't always attend their scheduled visits on time, or just completely miss them. This also results in these missing measurements or missing data. A joint model can help with this. Great. However, a joint model requires multiple measurements from patients. This could be expensive if the tests for these measurements are also expensive. They also take longer to compute than the more basic models. And also, who knows about joint models? Well, there's me, you, and some other people. They're becoming more popular, but if people don't know about them, it makes them hard to understand and to interpret. So my research, I'm looking at joint modeling in heart failure. This is patients whose hearts are failing to pump blood properly. I take data from clinical trials and apply joint modeling to it. I'm looking at a biomarker, which is an indicator of disease from blood results. It's called NT-proBNP. This is released when there's stress on the heart. And using this biomarker, along with information on whether or not patients survive, I'm building a joint model to aid in prognosis or outcomes. I'm developing an application which uses this joint model to allow doctors to provide more accurate outcomes to patients based on blood results. Further research could highlight changes to lifestyles which may improve outcomes. Thank you.